Hello, good evening, everyone. And as promised on this occasion of Buddha Purnima, today we are going to get live again with Dr. L.M. Khan sir. Today I am in his chamber in Collin Lane. I have come here to take the blessings of Professor L.M. Khan sir. Today we are going to get live again with. So, those who are new here and have joined today, I would like to share some information about Professor L.M. Khan sir, as he is a renowned personality and everyone knows in India and abroad about him. But still, I would like to give a short bio about sir. Uh, he was a ex-director in charge of National Institute of Homeopathy, Government of India, Salt Lake, Kolkata, and of the Board of Studies UG and PG of Kolkata University, Homeopathy Pharmacopoeia Committee. He was also a member of postgraduate of West Bengal University, Board of Studies postgraduate of University of Health Sciences, Special Committee for Homeopathic Drug Proving, Special Committee for Clinical Research for Central Council for Research in Homeopathy, and autonomous body under Ministry of Health and Family Welfare, Government of India, New Delhi. He is approved guide of PG of Organon of Medicine of Central Council of Homeopathy. And also he is the renowned author of the following books: Ignatia in Cancer, Allergy, Curse of Civilization, a treatise on homeopathic pharmacy, Wisdom of Imponderabilia, X-ray, Wisdom of Sarcourt's Prognosis, Kent's Observation Illustrated, Pleasure of Prescribing, Minimum Syndrome of Maximum Value, Thuja Occidentalis Reflection from the Clinical Bedside, and Politics of Prescribing. So here I am. So I would like to call sir so that all of you can have his blessings and his treasure of knowledge on this day of Buddha Purnima. Assalamualaikum. Sir, welcome. I would like to shift to different place with the voice recording. Sir, you had promised today that you will share some knowledge of yours, your treasure of knowledge on this day of Buddha Purnima. So here we are today. Sir was not well. Sir was a bit unwell since 3-4 days, but as promised, Sir ne bola ke we will continue with the live session today, as promised. So,
for the occasion of Buddha Purnima, a day we consider is a very pious day for especially students and teachers. We have got a very good bond on this particular day. This is the promise, the day of the promise to maintain the relation between Guru and the Shiksha, student and the chair. Student and especially teachers having divine relations. And I appreciate your choice of the day on Instagram to share some of the knowledge to your audience and those who are going to attend this Instagram. Last Instagram, I had some question from you, and I try my level best to answer. For today, the remaining part of the question, which I like to share, among them especially, which is very admiring to me. The question is the side effect of multi-drug and mother tincture. Very important for consideration of the present day practice, and especially for awareness. These are the two different things. Multi-drug prescribing, I think it is very injurious. And we are not going to trace any side effect. Very difficult to trace. One medicine has got their own side effect, another has got their own side effect, and when two both meet together, they have got the third side effect. So as you are going to use as much as multi-prescribing at a time, the side effect is going to be hazardous, which is very difficult to test and counter. I am very much fearful when I got the cases of patients who are taking multi-drugs for a longer period. I could not understand their symptoms from prescribing or their symptoms from encountering. Therefore, we have very chaos conditions. And this chaos condition even guide not a proper drug. Then what to do? In my humble opinion, what I am doing in my practice life, that wait and watch. If patient is not very serious, in that condition, we give placebo and try to make them to neutralize by gradually their symptoms of multi-drug poisoning. This multi-drug effects may possibly to become neutralized on the basis of the time factor. In aphorism of organ, especially 74, 75, and 76, these are related to the how, especially related to the allopathic drug, not rational drug. I think the multiple prescribing is also a non-rational. There is no rationality. Therefore, I assume to counter them according to after 76. Allow the vital force to neutralize. In Italy, later there is a one word. If it is possible to all your audience, they bring some of the books, especially organal, That is the spinal cord of the practice of homeopathy. Without the perceiving of the organ, it is very difficult to prescribe homeopathic medicine according to the rationality. Rationality means no side effect. Hahnemann is going to individualize himself in the profession of medicine. Then only by his rational attitude in the practice. Minimum medicine, minimum dose, by which patient is not going to produce any side effect or we call arthrogenesis. In Hahnemann's time, there was physician, least physician, who practiced this type of prescribing. At that time, mostly people are in favor of this allopathic system. But nowadays, homeopathy itself is going to be deviated from the center of the gravity and getting the suppressive attitude of the treatment. The best judgment of the patient. Some people are, when got opportunity to sit with me, they argument with me that I have a good result with my respective allopathic have got also good result with their non-rationality. Last two things. Ayurveda also declare that they are going to prescribe it by multiple joint medicine. Unani also has been declaring of the wonderful drugs prescribed by their composition of medicine. But as far as my knowledge is concerned also, in Unani medicine, single medicine also has got their own approach. But there is no such minute doses. Question of differentiation is very simple, that no question of minute doses. Now, another group of the question is question of mother teacher. Yes, there is a scope of mother teacher prescribing in homeopathic system of medicine. We have got ample medicine where our reformers prescribe mother teacher and they get very good result. Especially I am saying about in the Clark dictionary relation with article. But his own unique style of giving mother teacher. This is drop doses or natural level. Especially to the cancer, esophagus, stomach. I have seen also Dr. Bholanath Chakravarti Sahab, the prescriber, I can say, is a very unique prescriber in this world. He used to give medicine in mother tincture also. Some carica papaya or mitocalam, etc. But at that time, I was having some one-sided ideas that prescriber should be your potent as medicine single. That's why I'm not going to look after, care too much of the prescribing of Kodada in mother teaching. Still, I'm not sure. Very rarely I have seen a mother teacher with Dr. Gyan Sahab, especially passive role. But what I have got in my experience, I used sometime an occasion where the pathology is advanced. Patient's capacity of reaction is very good. And indications are not very much prominent according to 153 or given the article. Therefore, the scope of prescribing indicated therapy, whatever may be the indications, they used to give in mother tincture, drop doses, small doses, especially 5 drops, 7 drops, like that. I'm not going to encourage mother tincture prescribing, whether I can say the prescribing of mother tincture is a need of the position, conditions, situations. When you have, you can give. Otherwise, suppose I'll give you one example. The heart insufficiency. Cases of the heart insufficiency, when the heart power is not very good to sufficient supplies of the body due to the muscular weakness and many other symptoms. My friend, in that situation, the old age and very advanced pathology, I prefer Crataegus horse in mother teaching. As this mother tincture is based on some indications, I like to share with my pleasure of your audience the present, the day of Buddha Purnima, the day of a Guru Ashirvad of the Guru, that whenever you have got insufficiency in the heart or heart, whatever may be the name of the disease, if the patient has got insomnia, this is very marked indication. We boldly prescribe. I have got my own way of giving mother tincture. It is not going to produce any moving and side effect. But I have to know that about 15 to 20 drops, or maybe 20, put in a 1 liter of water. Give 10 to, and give the doses 3 times a day or 4 times a day, according to the situation of the patient. And whenever the medicine is going to finish, at least 1 or 2 can, you put again 20 drops and 1 liter of the water. Give 10. What is the importance of giving 10 for? That every time our medicinal power is going to be slightly increased. So therefore, there is a little chance of producing any side effect. Since last 10 to 15 years, I am using and having very good result. So if you give mother tincture according to the pathology, according to the age, according to the situation of the patient, still we need one indication. That is a very milder form of homeopathy, but still homeopathy. and there is the least chance of side effect. Those who are using random mother tincture, they have got some side effects. And this side effect, you must watch the particular prescribed mother tincture to matching with the proving of the symptom. Suppose the patient is going to use for a longer period to produce sleep like passive. And maybe they are going to produce some of the side effects of this. And this side effect we are going to match with the proving symptom of passive and the patient symptom. If it is the matching, we need to counter the passive. One by some of the strong indicated remedy or by gradually reduce the passive stepper off and put on that some indicated remedy which has got strong similarity with the patient, including the insulin. Insulinia, there are lots of factors which has got responsible for producing insulin. Nowadays, after studying carcinosin, I have seen a random prescribing of carcinosin, unreasonable prescribing of carcinosin. There are certain amount of indication. If you give on the basis of indications, the proper dosage and proper potency, you overcome the insulin and patient is never going to take any medicine for insulin. I think you giving this question, multi-drug and mother tincture, may satisfy to my explanations, or you may have got some question you noted. We hope in future we are going to justify and satisfy your audience. Another very good question which I like to say about it. Should we prescribe on symptoms or repetition? This question is slightly going to be difficult. Either you repetize, you need symptoms, or you prescribe by your symptom according to the material medica, you need symptom. Symptom is one of the best resources, information by which you are going to select the medicine, either from the repetitive or from the material medica. Question should be like that. I'm going to, though I belong to the family or tradition of the Bengal, where the dominating features in the prescribing is the material. And especially for me, most classical books written by material medical and some other fountainhead of homeopathic material like TFLN, bearing guidance. These are the, I think, the most important true and tested information for you. If you are having a prescribing and not trusted and true, then you need to study it. And especially in your young age, people who are going to practice and getting failure, I think the most disappointing factor for the future prescribing. That's why simply one thing I am saying, the prescribing basis should be tested and trusted. But I am doing They test it with the books like Honeyman, TFLN, Herring, Clark. These are the tested and trusted by presents serious generations, those who are claiming their practice with the help of the indication, like NASH, like SCLA, Google, etc. etc. There are many more. Currency. And some of the name which is not found in the history of homeopathy. They are vanished. But they are very good prescribers. Very good prescribers. In literature, you have got some available cases like Dr. Cass, the contemporary physician during the time of Kate. There are many physicians during the time of the Kate having a marvelous and wonderful prescribing. But due to the aura of Kate, they are going to suicide. This, our literature, I can say, is the most important evidence of their indication in prescribing. One thing I found that in my life, that all these previous physicians, if they prescribe their medicine, they are not going to fully declare the indication for prescribing. That is one of the very important things which I found in my practice, difficulties in my practice. After a good amount of repeated study of the cases, then you study of the material medical. Suppose I'll give the example of Dr. Boger cases, very difficult. Until 5 to 10 times I study the case, then material medical, especially Boger. Then I am going to get it for prescribing according to the rules. Similarly, the many physicians, they are not going to disclose on what indication they are going to give the medicine. I am very much appreciate some of the physicians, especially E.B. Nash, who is giving some indication, the flow of the indication, the charming or charmful indication by which this gentleman prescribes medicine and gets the result. And he declared, I'll give the example of Nash readers. You read Amon, then you easily understand that attitude of Dr. Nash related with prescribing. I remember one physician who was too much admired by Dr. James or Dr. Mundas, the British physician. His name was Fairview Wood. He was very good prescriber. And many times I have found some of the beautiful indications of what I learned from Dr. Mundas, the jhalak, the traces in the Dr. Fairview Wood prescriber. I'll give you one example. You know that in National Institute of Homeopathy, a lady, Mahua Mujumdar, very hard-working lady and assistant of Dr. renowned physician Dr. Srimal Sarkar. Once I asked her to shared his experience in our seminar. She has got very good knowledge. Please study the different articles, journals of our historians and their indication. They mostly share in the Facebook. Once we share a case of Dr. Firji Wood, where Firji Wood prescribed Vipera of the opposite symptom. What we know, if that thing's hands leg is going to be high, the most severe application. This is one of the strong keynote of Vipera. I used many successful of it. Very good result. Vipera by this particular indication of patient having aggravation as if going to be burst by handling the extremities of part. Many cases I got very good. Once when I read this article, thanks for the Dr. Mahua Bilizar, that he used opposite indications of Vipera that the patient feels when he is going to hang the legs, hang the hand. Very, uh, very rare occasions. But for me, it is not rare occasions because I have seen the beauty of the prescribing in the hand of Dr. Gyan. Once I remember a case of, but nowadays, there is a no value of this beautiful prescribing. Value I am saying, value have, practical value. But some of this poor learner and making himself become wise man, they are not going to be appreciate, rather enjoy. Better they are going to be countering and criticizing with the help of the knowledge of the material. I have many times faced of this criticism, but I shut my mouth. It's better to shut my mouth. So I remember one case of rheumatic complaint. When I finished my case, the result was nil. I am not able to prescribe this. So it is looked like Calcutta. But the patient has got serious aversion for it. Very shocking. And but Dr. Mundar prescribed Calcutta. Very shocking to me. And simply because at that time where we learners always keep mouth shut, observing from the two eyes and listening from the two ears. This is the best process of the learning from their books, and we do follow the procedure. We have got please question to our teachers. Teachers, if fit, they will explain. After Calcutta card prescribing, I gave 201 dose, but my face was not happy. After a few days, he asked me, why now you are not happy with prescribing of my Calcutta card? Wait for 1 month. Because Dr. Mundar gave medicine for 1 month. One single dose, 1 month. 1, 2, 3, 4, there is touching. Patient came after 1 month. Medical history. Unbelievable. After 1 month, patient came without a stick. that mortality. The doctor look after you and laugh. Still you are not believing my prescribing of Kalpika? No, sir. Whatever you prescribe, for me, it is an indication for prescribing. So I know from today, the Kalpika part is abortion for me. And he again will laugh and say, no, my friend, this is one of the angles of prescribing. And, but I never ask again that where you learn about this. Nothing. This is simple an attitude, but nowadays we lost of this beautiful scandals. We are not getting any scandal like that. Then gradually in my practice life, I used many times, especially in NIH and sometimes in my clinic. And those who are around me sometimes become like that, like that. But I know that prescribing on the opposite, you need to understand to perceive organic and material medical seriously, especially pure. You know, one of my habits that whenever I am not able to understand the Darshan prescribing, I just go back to the not repertory. I just go back to the material medical, especially pure, and just go back to the organ and giving the matching. Unfortunate part of the present day prescriber, they could not understand the beauty of Hahnemann explanation in the organic, primary action and secondary action. But in the past of Bengal scholars, those who are very expertise in organic, they know the beauty of primary action and secondary action. They know the beauty of the study of homeopathic material, especially Pura. Because the beauty and I can say a rough word, jugglery of the prescribing primary action and secondary action is going to be disclosed by only one material, and that material is the material capital. And when I got some opportunity in future, I will bring material capital. I showed the examples of this beautiful prescribing. In my life, I used, but very difficult to explain because the people is going to be confused because even nowadays present situation, the student is going to teach their master at the field visit. They think they have got something wrong with the master. They have got no courage to ask why this is going to be happen with you. Especially nowadays, they are really, now I'm going to think this, after this session, I may stop the webinar. Because when the people are not going to reading seriously, listening and going to the comments. And I'm going to give a deep-seated medicine, constitutional, polycraft medicine. They doubt on me. These are not polycrafts. Please discuss polycrafts. It's very hurting to me. If you claim that his guru is guru, what he decides for you is a benefit for you. But nowadays, people are not giving so much respect and regard for the teachers, especially learning point of view. So, sometimes I have got some of the cases in my practice some opposite modalities, just opposite, as Frisdy, Frisdy would prescribe a medicine of prescribe this hyper. You know, in the past, I have got very good gurus, not only who teach me homeopathic materia medica or gain and everything, but then lifestyle also. Among them, one personality was Dr. Mendes, very lovely person. I remember when I very much frustrated with the teaching and assisting Dr. Gyan Chundas in his clinic. So much frustration. I have got too much ahankar for my knowledge of Kriya Vedika, and every day he is going to slap me with the shoes, juta maar. If I think the patient may be prescribed for arm, suppose and he give grapes. What a differentiating features between the mango is big and grapes are very small. When I think grape he is going to give mango, when I see mango, he prescribe some other medicine. Very confusing to me and very frustration. So one day, many times I decide I'm going to leave doctor and reduce this and wasting the times. One day I meet with great gentleman, Dr. Mendes. I'm moving to the Central Avenue. He's going with taxi. He shouting, wait, and he leave the taxi and come to me. There are few discussions, and he told me, how is your Dr. Das teaching and understanding of homeopathy? I said, very frustrating, sir. Very depressing, sir. I'm planning to leave. But the love, the teacher who loved me so much, who loved me too much, and the love does not allow me to leave. Then he said, what's the problem? I said, the problem. If I think Brania, he gives phosphorus. When I think phosphorus, he gives economic. So much. It is for pushing to prescribe. I told him. Then he told me one long sentence of what we call just Sanskrit. In Sanskrit, we give the Ashlo. And this means I forget this. He told me that this means that if you want to learn from your Guru, you need surrender, submission. Then you learn from them. Otherwise, if you have got a power to bring knowledge from your Guru, make it be snatch from his mind to your mind. And that is very difficult. Not such a student, and he is not such a physician or teacher like Dr. Better to make yourself surrender. I never forget the ideas, suggestion, very brotherly suggestion of the Dr. Mahendra Singh Sahab. I have many examples of this gentleman's teaching in my life. One more example I remember. You heard the name of Dr. Yuardar Salaf. R.R. Yuardar. Rakhal Raat Yuardar Salaf. Very nice man, with a very good deep knowledge of homeopathic medica as well as organum. He wrote some of the beauties of the organum and its explanations, especially non-English text. This is small. I think every student should keep his book with him. So one day, the discussion, he told me that what is Guru? As because today is the days of the Guru, so I have some memory with the my gurus which I like to share with you. This Guru Paruma. So Guru, the person, again he gives a big stroke of Sanskrit. He said, Guru, who you are bringing here students from the deep whole andhakar towards the light. The real Guru is bring you from the deep andhakar, deep darkness, to bring the light of knowledge. And he told, it is going to open your eyes. There is a one piece of lakdi, or we call it in salafa. सुरमादानी के अंदर जो लकड़ी होती है जो आग से लगाते हैं. He told that Guru is going to make a put a salafa in your eyes and open your eyes. Thanks to the noble soul of Dr. Vendra Singh Sahab and Dr. Jawardar Sahab and many others also. So nowadays, teachers always try to make the student from the darkness to the light. Light is very important for a person. And darkness is always a negative side. I remember one of the German personality of medicine or like both Goethe. Very learned. I used to in German, but somehow I have got some of the English translation. So I enjoyed the Goethe. And Dr. Jundar is very much appreciating the Goethe. When the time of the death, Goethe comes and he's become very anxious. And then the soul is going to be departed. He's starting to cry. Give me light, light, where is the light? Give me the light, give me the light. All people are bringing light. But he said, no, I need light. Means he's still at the time of death of the deathbed. Man like Goethe is need for the knowledge. I honor Goethe's his beautiful attention to serving humanity as well as giving the importance of the light, lightness, knowledge to the events of the Buddha. My friend, I have some, but I'm not going to restrict myself. Sometime in my webinar, I give some of the this opposite prescribing in short. But I think people is not going to be appreciate another learn about the beauty of prescribing, which I learned from the Dr. Das Sahab, Sri Shri Sahab, and anyone. I will give you one more books, Dr. Wheeler. My humble request to you, my friend, please try to learn this book, which unfortunately is not published by Dr. BJ. At some time, a request also. Jain Sahab, Antier, practically especially, Kuldeep Jain, and later on some other person also. Please bring this book and publish your publishing. Because you see, I think this is one of the best contributions to the homeopathic system to understand the homeopathic philosophy and especially material. We also discuss this beauty of prescribing, as we call it, in the sulfur, the chapter of the sulfur. It's prescribing on the basis of opposite. Last class, I discussed one of the indication of some medicine. I will show you. That is a symptom found in, you see, back calf. Helensky wrote said, which I taught by one of the audience of Academy of Christ, that flows only at night or when lying. But I many times prescribe opposite modality, and which I shared last and got faced one of the suggestion of my members that you have got a slip of the tongue. This is not matter. I keep silence. You know, what do you mean by the slip of tongue? According to the Freud, what is slip of the tongue? Freud slip of the tongue. Freud slip of the tongue means you have got to deep in your mind, which is going to slip from your tongue. So there is a deep unconscious level is going to be slip of the tongue. Yes. My friend, what I have given the example, what I am giving the example of the primary and secondary actions, it is read, not then you criticize. Yeah, you should be. First learn as I am the learner with my teachers. So I think too much I am going to talk with you. I think you have got time or not. But one more, the question of retinal hemorrhage. I am saying very simple that In retinal hemorrhage, you need the medicine who is tendency for the hemorrhage, or we call hemorrhagic diathesis. So one more question: skin eruption is cure or suppression differentiate? Simply one thing. Nowadays, I have facing many seminars where they claim that skin eruption is going to be cured. But unfortunately, I see the shed of the skin eruption. According to Hahnemann, if skin eruption is going to be cured, that is no trace of skin, not a simple trace, even the color. And this symptom is going to be followed according to the heredity. Then you claim yourself. Sometimes I just simply spy of using all these things. Because the people nowadays presenting their seminar, they have got only speaking capacity, not listening capacity, not learning capacity. They have got enough learning. I can say our profession is going to be, can say that, Gumrah. My profession is going to be hazy knowledge, disappointing knowledge. And that's why failure and the failure and the failure. Last question: medicine for prevention of the caries stage in children. I simply say about that caries need lots of accessory factors, among them dental hygiene of the mouth. That's very important. Then constitution. Sometimes I give prescribing medicine, but unfortunately could not follow their dental hygiene. Result is no prevention. So those who ask this question, my humble suggestion to them that the combination, the bond between the hygiene and the prescribing constitution is only way by which you are going to prevent the caries or any other disease also. Management of the diabetes, I can simply say that just see where is the disease? Disease in the pancreas, and in pancreas a cell which is demonstrated by Lingerhand. It's very small. This is the defect of this particular, which is going to secrete the insulin, main factor for controlling the diabetes. If it is dying, if it is not working, then you should give medicine, constitution, to make it awake. But here again, I will share you that you should be control the diet, because the diet is the important factor to control the diabetes. And there is a lot of things for management of the diabetes, starting from exercise, walking, medicine, food, mental stress, mental strain. I try my level best to make a good result with diabetic management, but fail to control the stress. And that's why not very much success with diabetes. This few questions were shared me by you. I try by whatever may be my knowledge, understanding of the practice. I share this present day the most vulnerable day of Buddha Purnima. And I pray to all of you, including me also, that God maintain us the temperament and tendency for listening and learning. Thank you for today. I hope we are with you in future and with your some very good question from your audience. I appreciate your audience and my best wishes for you and your audience. Thank you. Thank you so much.
Thank you so much, sir.
कोई क्वेश्चन है?
Sir, Dr. Naina Chawla is asking, good evening, sir. How do you start a spiritual journey being a homeopathic practitioner?
देखो ये जो चावला जी है ना, ये बहुत अच्छी स्टूडेंट है, बहुत सीरियस एंड शी इज studying with Dr. Rajesh Sahab, a professor, organal vaccine college. Very serious student, very serious teacher, अच्छा prescriber, and I think she learns homeopathy, and I am thankful to her that I found her many of my webinar, even seminar in Calcutta. She used to attend. I think her question is not very problematic, slightly a question of understanding. I heard that she has got very good practice. But yes, sir. And my best wishes. आप ऐसा कर लो इन सबों का क्वेश्चन नोट कर, फिर नोट कर हम लोग नेक्स्ट सेमिनार वेबिनार में, ठीक है? और छोटा छोटा बात मैंने बोल दिया, लेकिन बहुत डिटेल बोलने की बात नेक्स्ट टाइम भी आगे. Any other person?
Thank you, sir. Sir, you, आपकी तबीयत ठीक नहीं थी, still you continued the second episode of this series of Instagram. Thank you so much, sir. आगे भी
Thank
आपसे
you so
क्वेश्चन
much. God bless you.
Thank you, sir.
Thank you.
Thank you so much, sir.
बंद कर दो.
Thank you all for attending this special episode on Buddha Purnima. If you have any questions that you want to ask to Professor L.M. Khan sir, Dr. L.M. Khan sir, you can DM me your questions so that we can have your answers in another session of Instagram live with sir. So till then, I'll catch you soon. Thanks all of you for watching, for being a good audience. Goodbye.